Hello, everyone. Welcome to this edition with Afternoon Cake Series. Today, our guest is Filipa Fixe Santos from Portugal, and she's the board member as well as healthcare director for Glintt, which is a company operating in Europe, Africa, and Latin America. And she has been very inspirational doing research, but then going to work with technology sector after graduation. And as I hope you're having a nice cup of tea or coffee today, over this next half an hour, we're going to hear some stories and tips, how you as well, either you graduate just from med school or maybe already doing your early stage startup, what are the tips that Filipa can give and so you could implement to accelerate your tech career in improving medicine. So hello, Filipa, and welcome to the afternoon coffee series.
Hello, Timo. Hello, everybody. Thank you for the invitation. It's my pleasure to be here today with you.
Maybe in the beginning, could you share a bit of your background? I see that you were studying very interesting degree, which was double degree in Portugal and Denmark. So quite some few years ago, but it was very novel technology. That was almost, I see, almost 20 years ago. I think it was in the early days of nanotechnology and biotechnology, times where we didn't have smartphones. We didn't have, like I have the wristwatch detecting my heartbeat. I think it was a very and exciting days. And then you went to quite after the graduation to already work for big corporate Portugal Telecom, and you have been quite some years, I think, in the health technology transformation, seeing how people didn't have mobile phones at all, and now basically everybody has so many sensors around them, and especially the new and upcoming 5G that definitely will be transforming our lives in the next 5 to 10 years as well.
Yeah. So I did my degree in chemical engineer in Lisbon, University of Lisbon, and then I started the master thesis and the PhD on developing DNA chips for detecting SNPs, so mutations that could detect or prevent a disease. Yeah, at that time it was, I think, very different from the things that we were supposed to do in labs. So new materials, new techniques, and I think most of important was that we were mixing teams. So I was a chemical engineer, then I have to go into a clean room inside to make a chip. That for me, it was a new thing. Electronics, mathematics, simulations, and also combining this with the biological part and the medicine part. So yeah, I think it was an amazing experience, not only because it was between Portugal and Denmark, and of course you learn a lot of things because you are abroad and you need to grow up as you never grow up because you are in your country in a comfortable way, and you move far away, new friends, new colleagues, new cultures. So that I think it's one of the most important things that I take from the PhD. And I think if you have the chance, you should go for it abroad and experience and see the world. I think this is the back package that is one of the most important things in your life. And also combining different knowledge. So you need to go out from your comfort zone. Because it was much easier to continue in biotechnology or in chemical issues, but going out from my comfort zone also made me grow up and learn new things, and that I think it opened up the possibilities then to move forward to the corporate world. But before that, I started to start up companies in the area of biotech and medtech. But at that time, as you said, 20 years ago, more or less, the time just flies. It was even more difficult to get the financial issues done and the bureaucratic issues also, because when we are talking about a startup on biotech, on DNA chips or lab on a chip, it was something that the investors didn't know, and it required a big investment up front. So one of the startups still continues, and now it's a company producing for outside Portugal, and the other one didn't see the light. But anyway, you need to test it, you need to move forward. And again, going out of your comfort zone, it's quite important to make sure that you are learning and you are making new things. And that is one of the things that I take from that.
And I think it's especially interesting is that I think 20 years ago, when, I mean, these days we see, I know that also in our EIT Health alumni community, we have quite a number of successful female entrepreneurs from Iberia and Peninsula, but back in the day, like how actually you got that initial inspiration to actually go into the field that I think back in the day was very dominated by, I would say, male engineers that I remember, like physics or this kind of engineering technology sector. That is, I think, not very typical choice. That was it like somebody from your family that inspired you, or like where did you get the inspiration to do that first step in the first place to get into very technical area?
Yeah, that's a funny question, because I remember that back on the degree on the faculty Institute Superior Technique, well, the chemical engineer had 50% women and men. But when you go to physics or electronics, there were 1 or 2 women inside a room with a lot of males. So it was very different from nowadays, that you see a lot of girls going into engineering. Well, my choice maybe influenced by my father, that worked with the chemicals and on that part. But I think most of it was because I like the disciplines from the STEM. So physics, chemistry, biology, that was the thing that made me go for an engineering course. So I didn't think too much about it. And you know that when you have 16, 17, or you don't have so many clear choices, but you go for the things that you most likely. And at that time, physics, chemistry, biology, it were my favorite subjects. So I went for engineering. And then, of course, you have to think that the course is just a tool that makes you, and then the PhD also make you open up your mind to get new knowledge and to think about the things that you could do in different areas. Of course, you are not dedicated just to chemistry or to biology. You need to embrace and see the world in different perspectives. And again, having different perspectives in your team is, it's, I think, quite important. But my choice were basic because maybe influenced by my father, of course, but also because I liked that disciplines at the time, and I went for it.
Well, awesome. I mean, I hope that this is also giving inspiration, and we actually see that like, you know, things have been changing as in our community. We have like more and more like active people, especially coming from the very traditional South as well. But looking into what has happened in the 20 years, I mean, that was really frontier technology 20 years ago, like doing the DNA chips and things. But now at Glintt, I was reading that it's also very exciting as you are not only in Europe, but also in Angola and Brazil. Your technology is being used in hundreds of hospitals and clinics, as well as at least 14,000 pharmacies. Yes. which can like, you know, probably is impacting millions of people. So this must be a very exciting time, and especially I think like going to those new markets of LATAM and Africa, where probably like they are doing technology jump that you know is going from papers directly to mobile first environment.
Yeah, so yeah, I think we're living exciting times inside healthcare. So I mean, we all know that we all have a lot of technology. As you said, 20 or 10 years ago, the smartphones were not so smart, and we didn't have so many connected devices. Nowadays, we have more or less 6 connected devices per person. So it's amazing in 5 years, more or less, what we grew in terms of the number of connected devices and the number of data that we have. But we were seeing that in healthcare, the technology was not so embraced by the ecosystem of healthcare. We see that more and more people are taking care of their well-being and health, running, taking count of their steps and so forth, and sharing that with the friends and others. But then when we go to treatment, we still saw a lot of paper and repeating exams, and still the doctors and the nurses doing a lot of work that they don't supposed to be doing, because I mean, typing or repeating the information it's not making sense nowadays. With this pandemic crisis, I think we saw a movement and looking to the citizen journey as we never saw before. I mean, the vaccines, of course, the background of the vaccines and the scientific part were already being done for 10 years, like Moderna. But the capacity of putting this into the market was amazing, because the institutions, the governments, the policymakers were looking at the citizen and the way they could put this onto the market. So we went through years of putting a vaccine into the market for months. And there were things that worked very, very well during the pandemic, that online consultations, the telemonitoring, and others weren't so good, because, I mean, the physical contact should remain between patients and health professionals. So we see a speed up, and now we need to understand what went really good and the things that went not so good, and correct them and make sure that this digital transformation in health is being done correctly, and also with the cultural change, because we see nowadays that we need to have people that know about digital, know about health, so that to make sure that they are taking care of their own health, and that we leave time for health professionals to take care of the ones that are more have more difficult diseases, or more dedicated time for them. In Glintt, we saw that also because we are supporting a lot of hospitals in Portugal and Spain, and pharmacies, the community pharmacies, as we were saying, we had to pass from on-site to online contact with the clients, and that was possible because we were already very dedicated to the healthcare sector, and of course we need to break our walls, as I can say, to bring more innovation into Glintt. So Glintt has 20 years on the market. We have a very good knowledge about the healthcare sector, but to keep up and to be updated with innovation, of course, we need to bring partners, we need to bring startups, we need to bring universities, so that they can challenge us, and we challenge them to bring a new technology and new solutions that can be placed onto Europe and other markets, and that will promote more time for the health professionals and more care to the patients. So I think it's a very exciting world, and at Glintt we are looking to this world of health technology with innovation and the capacity of making happen it, because you need to put this innovation into the market, and that's, I think, one of the most important things.
Yeah, this is like exactly like very exciting time. And we actually have a question coming in, one of the viewers today. So Anita is asking that if you were now, imagine yourself 20 years back, but like in this today's moment, 2021, it seems like Anita is going to need to choose the track to study, like either digital health or medtech or something. Like if you were like, you know, starting a new PhD program today, what would be the research topic that you would study in this kind of digital healthcare transformation field? Would there be like something specific that really brings up to your mind? Because you also mentioned that as a Glintt, you're looking for this new blood and new startups to cooperate. So is there something specific that is really making you excited these days?
Yeah, I think, of course, I would combine health and technology with all the part of technology, electronics, mathematics, and simulation. But I think AI will be the next future. We are seeing that AI is changing the society as a whole. We see this in different parts of the society, and I think in health, it has to permit and has to allow much more time for doctors. So the doctors and the nurses will always have the final word, because I think empathy and human relation will not be replaced, but AI will be a game changer in terms of health. So I would go for it.
I think there was a good saying that you know, Skype is good, but it can't give you a hug, and sometimes you know you really need a hug, which I think even AI would know what hug is. Probably, like, you know, it would be not the same thing. Especially, I think, like in countries where I remember when I had my first projects in you know, Southern Europe, coming from the cold Northern Europe, where you know, Estonia, we are physically distancing even before COVID. It was so immersive to see how, you know, people are so close to each other, like, you know, the kisses on the cheeks and the hugs all the time. That definitely, I think, you know, the culture would not allow those things to disappear.
No. I think that is quite important. I felt that in the opposite way, of course, when I went to the Nordics. But anyway, I think the human relationship between every person and in the healthcare sector, between the health professionals and the patient or the citizen, needs to be there, and it will not be replaced by technology. But of course, the health professionals of the future have to rely on technology and not fight with technology, because it will not be possible. If I can make a scan and have an AI algorithm to analyze the scan and give already some notes and some indications to the doctor about the diagnosis, that I think will give more time to the health professional to discuss the treatment plan or the next steps with the patient. And I think that's one of the most important things that we are missing nowadays, is time, the quality time to discuss between health professionals and citizens, to make sure that it's a journey that is shared and has the same vision. So I think that's one of the most important things.
Well, yeah, time is, I think, the strongest asset to have for anyone, because that's limited. You cannot have all the cash in the world, but you still have 24 hours a day, and I think that's the limiting factor. But talking about time, like looking what you have managed to do in the last 20 years, we have a question coming from one of the viewers today, Lydia. And she's doing an early stage startup where she wants to negotiate with certain corporations. And I think one of the, you know, we have to say that the hassle out there, especially in some countries, is that if you are a female entrepreneur, getting behind that board table or to those important negotiations, or even to be considered, can be tricky. So do you have some practical I don't know, tricks or how maybe like those just fresh graduates that are running they start up, but are not that masculine, and operating in maybe countries where most of the board is male. Are there any good tricks to get behind those decision-making tables or into those circles?
Yeah. One of the things is that networking is very important. Normally, we still continue to have this bias that women don't do the networking because they are going home and children and whatever. So networking it's one of the most important things. Again, going abroad out of your country gives you a good back package on how to do this, on how to see other worlds working, other cultures, and this is also very important when you are inside a company or inside a world that is dominated by males. And also the capacity of listening and have other perspective on the table that sometimes the males cannot have it because they normally go for the discussion before listening. So I guess listening and also networking, it's one of the most important things. And of course, be passionate by what we are doing. It's one of the most important things because you need to go up every day from your bed and with a big smile because you are going to face not so, everyday nice things. So be passionate about what you are doing. It's also very important. But networking, it's a very good way to embrace yourself, to enhance yourself, and to connect with other people, male, females, and this is a very good moving forward on this world.
I was actually just thinking like that. You mentioned that females are better empathy, and maybe that is giving the advantage in this this world. That and previously we were mentioning the future is AI. I was just thinking like maybe females can make better AIs because they can we have seen some early AI experiments which we have seen that people say it's very biased, like many AI projects so far seem to be white male dominated thinking, and maybe in that sense like combining those different cultures or even like continents, I think what Glintt is doing and putting into females perspective, those AIs seem to be way more better if
yeah, with more empathy, I hope.
yeah
I think the empathy and sometimes taking care and looking to the other persons in the room, the women can do this in a faster way or having more empathy on that. And I think if we could move that to the algorithms that we are creating, maybe a better society will come from that. But still, we need to study a lot on this field of AI because, of course, machine learning and algorithms are running. Then we need to look at what is coming from there and how can we make sure that ethics prevails on this algorithm. It's also quite important. And I think there females have a word to say on that.
Yeah, and I think not only word to say, but also ability to scale up that, in a way that sometimes to scale it up a team, maybe it's hard to find, fellow companions, but for scaling AI, you need just more servers from AWS or Google Cloud or Azure, and you can go there and provide that for millions of people needing not only in Europe but also across the globe.
Yeah, and this mentorship of females and the role models that sometimes we talk, it's also important. Again, the networking and discuss this in an open way, I think it's very important for women that normally when you think about networking after work or during the work, you are always looking at the male side, or that's what comes on top of the minds. But again, the networking and the capacity of empathy and sharing the thoughts of females with other ones and with males, it's a way that I think will give very good results for the future. And I think the females the number of females in study in engineering and health related issues should grow up also when you look to direction positions or board positions. We need to have more women on boards.
But talking about this networking, I think well, some of our viewers today, they have been doing their masters and PhD research. Most of the networking classically for, if you're studying in school, has been, you know, when you go to a scientific conference and you do like a presentation on the poster presentation, or if you are lucky enough on the stage, which now, you know, the last 2 years, I think everything has been cancelled.
Yeah.
So do you have like some networking tips and tricks that those either students or fresh graduates could use? Like what's the best way to network in your opinion? Is it like, you know, LinkedIn, or chasing people down the websites and contacting them by email? Or like, if you would need to network, what is your secret power for networking these days?
Yeah, well, hopefully this pandemic crisis will at least not disappear, but at least will give us this chance to meet in physical way again. So again, going out from your school or from your university, it's one of the most important things, because if you stay on the same place, you connect with the same person. So that I think you need to go out from your space. And in the conference, in the space of networks, you should stay after the conference, or go to the dinner, even sometimes if you are very tired or you think that you don't know anyone and it's going to be difficult. But again, being there and talk with someone that presents you to other people, it's one of the most important things. But going out from your space, well, if you are in the engineering course or in the medicine course, you should go to conference where you have other different type of persons, different type of companies. And this, I think, will open up new possibilities for networking, not only in your space. That's one of the most important things that I would say for the students.
I think the last tip is especially relevant, most likely for somebody who wants, I think some viewers today are coming from startups, because like later you have to hire people. And I think when you're hiring people, you have to kind of find, you know, not only the person who does exactly the same job as you, but you know, that you need to find accountant, need to designer for your marketing campaign of your new, I don't know, molecule or whatever you got out of the pipeline.
Yeah, and sometimes the experience that you have in other sectors can be applied to healthcare. We should not only look to healthcare. If you see like a surgery room, it's like a production line of cars. Of course, with some constraints. Of course, you cannot compare one-to-one, but you need to have the right patient, the right nurse, the right equipment, the right doctor. As in the car line production, you need to have the everything done in the right time. And so sometimes thinking out, as you say, out of the box, or thinking other industries, what they are doing, and that can be applied also to health, is one of the most important things. And in Glintt, I think one of the main assets that we have is that we work with teams that go from doctors to technology and psychology. So to understand the need from a doctor or from an hospital, you need to have different profiles, or of course, to develop the algorithm, you need to have a person that is dedicated to mathematics and to this kind of technology. But to make sure that the technology is adopted, you need to move forward to a cultural, to a psychologist, how to make sure that this is used in the best way. A designer, it's one of the most important things that we need to have when you are thinking about a new product or a new feature. So this also compare with other industries and have this multidisciplinary team for us is very, very important.
Well, that sounds like, it's like a healthy diet, that, putting things together and well, I think I really like this analogy that, see what is like working in other sector. And I think I was reading somewhere that, innovation actually happens where two disciplines kind of like, mix and mingle together, that it happens always at the edges, that, you see something is working in, I don't know, transportation sector, and for example, cars, and then how we could do this, implementing the business like, model, or, some kind of feature from there into our field.
Yeah.
And I think this is also enabling that people who maybe not initially studied that field can work in that field. I think that we have seen like number of successful businesses where, the founders of Airbnb, they didn't come from like hospitality sector, but they were designers, or like, the Uber founders, they were not transportation guys. They were just like people who needed to get the car at the
they had the need of the problem. So that's one of, I think, all the background, the degree, the master, the PhD, or other things are just a tool for you to apply to different parts of society. You have to look to that as a tool, and that has trained your brain to have the abstraction to then apply this to different kind of sectors and different kind of industries. So I think that's one of the most important things. Not think just if you are an engineer, you just go to an engineer related field. No, I think that time has passed.
Yeah, but talking about that innovation, we have another question coming in from Peter, and he's asking that he's currently like doing a new startup, and he's on a crossroads because he thinks that, the technology could be applied for both smaller customers and larger customers, and like maybe you have a good tip to either. It's a good idea to go for those bigger customers in the beginning, which might be harder to catch, but probably more rewarding, or to catch the smaller customers first. That what would be like a good idea from the, if you are like doing the early days, what would you choose?
Well, not knowing the product, of course, and keeping this in abstraction, I would go for the smaller ones. You need to have good pilots so that then you have the trust to grow up. So the first testing, even for a big company, we cannot try to do the first product in the big hospital or in the big clinic to make the comparison. We need to go to a smaller one, or to a small division inside the big one. Tested, making sure that we have everything done, not only technology, but the adoption, the process, that sometimes you apply technology on top of the process that is not working, and it's not on technology, it's on the process. So we need to figure out all of this, and have a good 2 or 3 pilots, and then making sure that you attract the big ones, because they will always, normally they will ask for a proof of concept, how this is working, especially in health. When you look to health or other sectors where we cannot have mistakes or clinical errors. So I think we'll move for smaller ones, have the proof of concept, and then of course attract the big ones.
Cool. I think that's very practical, and hopefully, Peter, you took the tip from Filipa this way. But I see that John is asking a follow-up question, and as you operate currently in Portugal, Spain, Angola, and Brazil, what do you feel would be good to do that kind of first experiment? That European Union is like, very regulated. Is it kind of like smarter to do it in a regulated market like European Union, or to go to maybe less regulated countries in other continents first to get those first signs of traction?
Well, I will move for European countries or other countries like United States. Although they are very restricted with regulations and medical certifications, if you have success in these countries, I'm sure you'll have any other ones like Brazil, Angola, Latam. If you go from the opposite side, you will have a problem when you want to move for European and Asia or to United States. So my advice will move for European countries, although the regulation is very strict and sometimes bureaucratic. If you get stuck in something, I think United States sometimes with FDA, it's nowadays more easy to move forward. Again, I think this COVID-19 pandemic and the vaccines showed that we cannot stay the same as we done before, like years and years to get a new molecule or to have a new medical device onto the market. So I think Europeans and United States have incorporate that. But for me, it's clearly that you should move for these European countries before and then going to other countries, because then you have the stamp and the proof that it can be used with and inside these strict regulations. So that would be my advice. And of course, Portugal is a very good country. We are a very small country compared with other ones, and we love technology. So if you want to test it here, you are more than welcome.
Awesome. And actually, like that's, I think, yeah, making so much sense that, you know, if you manage to get through the hurdles and get the seal of approval from one of the two largest blocks, like, you know, CE mark or FDA stamp, then, you know, other countries probably trust, because again, I think we have seen this in other industries, like even, you know, I don't know, technology products, like, I mean, even your smartphone, like if it's like Apple, I mean, if US government allows to use iPhones, probably like they are good enough also when I'm somewhere out the sun.
And because they have the stamp from United States, because they are done in other places, but then you see approved and stamped for USA. So I think that will be the good way to move forward.
Awesome. That has been very helpful. Like, you know, this, because, you know, people are getting those practical questions, and that's why we are always so happy to have these cake sessions with this kind of very seasoned and experienced people, because, you know, you can run circles for years, but you know, in the end, those signposts are quite simple and sometimes just in front of you. Now I think people are maybe having the last sips of the hot chocolate or chamomile tea or coffee latte out there, and having the last bites of cake. But I'm thinking, what would be maybe your recommendations? Maybe like key. What would be the most important 3 things that if you could give it to your younger self, if you could go back in time 20 years, and you would be like many people watching us today in the recent just graduation or the last years of graduations, or maybe just graduated earlier this year and trying to do this startup, what would be the things that you have learned throughout your career, and probably you would like to go back and say to your younger self, like whatever words of wisdom that one might be?
So one of the main principles is that be passionate about what you do. That's, I think, crucial for everyday life and to move forward. The second thing will be, and looking back to my experience, it's to be resilient. Because this is very important. Not always the things will go as the way you are predicting or like it, but if you believe it, you need to be resilient and move on that direction. And then make it happen. Of course, you will make mistakes, but you will learn from them. And then you correct and you make a step forward. So make it happen. Do not stay in the theoretical thing, and make it happen and correct the errors, because sometimes we guessed at the first time, but normally it doesn't happen in the first time. So correct and then a step forward, it's also important. So passionate, resilient, and make it happen. I think it's, if I could say in these 3 ways, I think it's the things that I would do if I go back in my experience.
Awesome. And is there also a way that if some of our viewers today, or maybe some watching it later as a recording on YouTube, if they would like to get in touch with you and maybe ask a question that we couldn't cover today, what's the best way of reaching out? Is that an email, or should they
email or LinkedIn?
LinkedIn?
LinkedIn and email, please contact me. I will respond as soon as I can, and I would like so much to be contacted, because I think we always learn within this context. So don't be shy. Please, you can contact me, LinkedIn or email. I stay at your disposal.
Awesome. Thank you so much, Filipa. And yes, I mean, as Skype can't hug you, also don't be afraid. Filipa don't bite you if you send an email or LinkedIn requests. And everybody who is watching today, if it was your first time you ever heard about EIT Health, something that to go align with those 3 suggestions Filipa was just giving, be passionate, be resilient, and make it happen. The good news is that EIT Health and EIT Health Risk Program is there for you to support your ideas from the very first days of validation. So they are running programs to validate your business ideas, boot camps, as well as doing extra education, summer schools, and whatever not. So in order to make that happen, your ideas that Filipa was suggesting, follow the news that EIT Health and EIT Health Risk Program are doing. If you like this episode in our YouTube channel, you can put the thumbs up and liking it. If you want to see more episodes like this, hit the subscribe button and you would be notified our next recordings as well. Thank you very much for watching this episode. Thank you, Filipa, for joining us, and see you soon in the next afternoon cake session.